When I first received my BRCA2 diagnosis, I knew I wanted to do whatever I could to live a healthy and happy life. For me, I'm a worrywart, so I'd wake up every morning, I'd give myself like 20 breast exams throughout the entire day, and I was convinced I already had something. It was really hard for me to carry on my day-to-day, live a normal life when I didn't feel so normal anymore. I was looking at my Facebook groups and RealSelf and seeing these other women and hearing their stories of what the surgery was like and that they were able to get on the other side of it and how happy they felt. I knew that I was ready to find my doctors and start putting things into motion.
Sara's procedure is really broken into two main parts. The first part being a mastectomy that Dr. Richardson will perform through an incision in the crease, and the second part will be an implant reconstruction where we make an internal bra and place the final silicone implants.
There are different pros and cons and different risks and benefits of all of the different options. They really depend on the disease in the breast, but also about the patient's own situation. How do they want to look in the future? How do they feel about their body?
I encourage patients to really inform themselves, and I think this is why websites such as RealSelf are so important to this process.
Understanding expectations and communicating with your doctor and asking to talk to other patients to see what their experience is really important as well.
Preparing for surgery is what really gives me a sense of control. Being able to see photos of before and after 1 week post-op, 2 weeks post-op, so I can at least have the right expectations going into it. If I was able to read other women's stories and hear what their experience was like, well, maybe I could mentally prepare myself. It's really good for me to see the other side of it. The woman who wakes up every day and is so happy she had the surgery and she knows that she saved her life.
After seeing thousands of different patients heal, attitude is everything. So learn what it is that's happening and then allow yourself to be taken care of. Anxiety is not your friend.
Since this whole unfortunate thing has happened, I have seen a side of Sara that I only had glimpsed before. I think that I've just tried in every way I could think of to be there for her.
Being able to just have someone hear how scared you are is exactly what you need, because sometimes in the beginning people would say like, oh, it's okay, you're gonna be fine. Because it's hard for them to hear your fears. It's hard to have people hear your sadness. But my parents have been amazing because they just let me be.
As hard as it is as a mom to see your daughter go through something like this, it could potentially save her life. She wouldn't have to go through having cancer. And it was the best decision for her because it was her decision.
I know that I have the best team possible for myself. And I think it will always be scary up until I have the surgery and probably even after, but it's okay to be strong and scared.